Good evening. I'm John Wingate, and we're speaking to you tonight from an anteroom that directly adjoins the operating amphitheater of University Hospital of the New York University Bellevue Medical Center. In just a few moments now, you'll witness a modern medical miracle, the rebirth of a child. Channel 5, in cooperation with the New York Heart Association, presents live actual heart surgery, the repair of the heart of a living patient tonight. You know, just a few short years ago, most people with heart disease lived lives as semi-invalids in constant fear of sudden death, which might occur. But this is 1958, a year of hope for the heart troubled. And this is a program dedicated to spreading that hope. Quite frankly, for untrained eyes, an operation can sometimes come as a shocking experience. The eyes and the human mind are not easily prepared psychologically for the necessary operative and surgical steps that lead to the eventual cure of disease, the relief of pain, and steps that bring you back to physical normality and to well-being. It is not offered either to shock you or to excite you. It's offered because we believe that this experience can open up for you a new area of knowledge and experience for yourself, so that you may come to a greater understanding of the heart, its treatment, its care, and its cure in time of illness. On this operating table, which you've seen, is a young girl. Now, without the surgery she will undergo tonight, and with careful regulation of her activities, her life expectancy might have been 35 years. But with this operation, this span may be increased to a normal life expectancy, just like yours and mine. Heart disease is the nation's #1 killer and crippler of people in the prime of their life. 10 million Americans are estimated to suffer from heart ailments, and almost every family is affected by heart disease to some degree. But in the past 2 decades, heart research has made tremendous strides and advances. New drugs are helping millions to lead comparatively normal lives, while over 200,000 people, perhaps some of them watching, are alive and well thanks to the development of surgical techniques such as the one we're about to see. The preliminaries are over tonight. The surgeon has opened the chest of the patient, the young girl, and he's ready to start repair on her heart. Dr. Lord, the surgeon, has been equipped with a lapel microphone. If you listen closely, you'll be able to hear his instructions and orders to the nurses and the technicians who are assisting him. All right, let's go to the operating room.
The chest has been opened through the fourth interspace. Plate the lung in there. I think if your camera can... This is the heart beating here. A nerve comes along here known as the phrenic nerve. And this is the left upper lobe. I can plate it a little bit more. Left upper lobe of the lung. And this is the left lower lobe right in this region. The head of the patient is on this side, and his foot down here. This is his front and back. No, left hand is it. We will depress the lung fairly, expose the aorta, which is the large artery coming around in this region here. We just started the dissection of the pleura, which overlies this artery. Well, the suture, please. I'll put sutures in the pleura to retract it in order to expose the ductus. I don't need to tie them unless they're bleeding. Sorry. Go ahead, please.
Dr. Lord, those of us who are watching the procedure on the monitor notice that one of your assistants, I think it's one of the nurses, has her head directly in the field. I think if she could move a little bit. That's a big help. Now we can see what you're doing.
Dr. Redford was heard out very quickly.
Are we all right?
Yes, Dr.
Clamp.
Dr. Lord, are you working on the sac covering the heart at the present time?
No, this is the visceral pleura over the aorta.
Dr. Lord, it looked to me as though a stitch were being taken. What was that?
That's what we've been doing, yes, to tack pull the pleura back. Now, if you can see that, this is the fat and fascia beneath the pleura overlying the aorta.
I might say that the pleura is the covering of the lung, and the lung extends up over the heart. So in order to expose the heart and see it clearly and to work on it easily, the lung has to be pushed back to the side, and that's what's being done at the present time.
To those of you viewing, I might explain that Dr. Derrier and the other doctors here with me are connected by an intercommunication system with Dr. Lord, so we can talk back and forth when he is not so busy as he will be later.
Another suture? Yeah. No, they all listen there.
I wonder, before Dr. Lord leaves the patient, whether he would like to say anything over the communicating system between our room and the operating room.
Well, we're close to the skin now, and I don't think there's anything more to say except I'm mighty happy it's going all right.
Thank you, Dr. Lord.
The amazing thing is the way these scars tend to disappear. I saw a patient within the week that had a similar procedure done in a Midwestern city only 18 months ago. And this scar is practically a hairline following the course of the rib, and almost invisible after 18 months. Another thing that interests me with an incision of this size and an operation of this type, these youngsters, as a rule, have very little pain. They may have a little bit the next day, but the pain element disappears very, very rapidly.
Those are resilient after that. They're much better than those of us who are older at getting back on feet.
Well, that's the story that we hear. I think children recover from surgical procedures more rapidly than the geriatric patient does, without question. But sometimes even our geriatric patients amaze us in the rate of recovery. I think Herbert Hoover's a nice example of it. He's a man,
a gallbladder operation.
Yeah, a man in his 80s that went through an operation like a child would.
I think newsmen, shall we say, sort of pestered me, as they do from time to time, about his advice to elderly people who want an operation. Mr. Hoover said this made up his mind for him. Get it and have it over. When he walked out of the hospital.
Actually, as surgery has been developed, not only in this particular field, but surgery is done on the younger age group from the day of birth up to the geriatric patient in his 90s with much less fear and trembling than 10 or 15 years ago. These people tolerate modern surgery very well.
Any moment now, we'll have the word that it's over.
The incision is all sewed. Sutured is the surgical word, and now the bandage is being applied over the suture. So from all practical standpoints, the operation is completed.
Shall we rely on that final word from Dr. Lord?
That's right. The dressing's on now, and we'll take the drapes off for the easy one.
Operation complete.
All finished.
Thank you, Dr. Lord. And we'll see you later. Here we are, operation over complete, and our grateful thanks tonight to Dr. Lord and a distinguished panel of doctors who provided such helpful commentary all through the operation tonight and answered all of this reporter's sometimes, what shall I say, questions. I've just received a cue that we should now go back to the operating room. Why, I don't know. So if the camera director is ready, we'll switch back to the operating room to see what
that would be fine.
we have there. Okay?
Yes, let's see.
Okay. Mabel, open your eyes, honey. Open your eyes. That's it, girl. It's all through now, huh? All finished. Say hello. Huh? Son, what's the matter, huh? What's the matter, honey? Huh? Huh? It hurts you a little bit, huh? Huh? No? No? Huh? You want to go to the bathroom, huh? Oh, you want to go to the bathroom? All right. Okay, honey. Huh? Huh?
I think now it's time to go back. We are, yes. The monitor's just behind me. Back at the operating room. Hi, once again. Right now, I think it's my privilege to need a man, to introduce a man who's done himself a proud evening's work. I won't say any more than that. You've been watching him all evening, and I think perhaps the most significant thing you saw was that quick flashback we made to the operating room after he'd left, and we saw Mabel, the 4-year-old girl who had been victim of heart disease after the operation. What else need we say? Dr. Jerry W. Lord, the operating surgeon. You look very calm.
Feel much better now.
Dr. Lord is Associate Professor of Clinical Surgery at the NYU Postgraduate Medical School. He's President of the New York Heart Association, and right now he's earned himself a rest. Dr. Lord, it may sound like a silly question, but it's the first thing that comes up. How do you feel?
I think after you've done any operation, Mr. Wingate, you feel an awful lot better, that things have gone well. We have our headaches and surgery, and when they don't materialize, we're mighty happy. Of course, tonight I was extremely concerned that everything would go well, so we'd not make people feel this was difficult surgery. It certainly isn't, and I think we could have done it a little bit faster, possibly, if and then some of the tension. But on the other hand, speed is of no importance in operating, as a rule, and one just does it carefully, and usually works out all right. This is certainly the simplest operation of any of the so-called cardiac operations. I was thinking about it the other day. I'm certain at least 30 hospitals in New York and the area right around it are doing these operations frequently. And there must be well over 100 or 150 surgeons in this area that can do them with considerable ease.
Tell me this, were you ever bothered? You had 4 powerful kibitzers. We can have a little fun now.
No, they're great.
Right on top of you all the time, Dr. Derrier.
I think everyone agreed there that they know more about surgery than we do.
You gentlemen certainly led me. All right, let's have from you the announcement. How is the patient, little Mabel Chin?
Apparently he's wakened up and is all right now. I think if everything goes well, should be out of bed tomorrow and home about 7 days.
Operation a success?
Yes, apparently it is. We'll have to check later on, but I think there'll be no more patent ductus.
What are the next medical steps for her, if any?
Well, actually, I'll probably give her some penicillin and an oxygen tent for overnight. And then tomorrow, if the condition's good, she will be out of tent and out of bed. And the thing we look for most is that there's no more murmur as there was preoperatively.
How soon before she can play with her friends and go back to a normal life?
I think we like to have them not do active exercises for about 4 or 5 weeks, and not competitive sports for perhaps 3 to 6 months. But as far as behaving like a child's going to school and enjoying things around the home, playing with the playmates in a not too robust manner, in about 4 weeks.
And so, ladies and gentlemen, we come to the conclusion of Operation Heart Saver. As a public service, and as a token of its belief and confidence in Heart Fund-supported research, Channel 5 has taken pride in cooperating with the New York Heart Association to present this special telecast. Here in this room tonight, we witness the rebirth of a child. Here, 2 miracles of modern science, heart surgery and television, which you saw, have united in this program of hope to show you that the once thought of as impossible dream of repairing a human heart has become a reality and a success. This is John Wingate. Good night.